Coming up next.
Now you say you don't want your marriage again, and there's by no means are you going to listen to me.
So why then do we get married? Where are you supposed to be more vulnerable? Is it not in the place of marriage? So does it mean that men are just getting married for getting married sake to have children?
Yeah.
What about the wife that is meant to be your helper?
25, why should I sit down here when I've actually met people of 80, 100? And I say, excuse me. I mean, look, 25, but I started school actually, my university is by 25. So you don't judge by the face, you judge by the quality of service. Hardly do you get encouragement from Nigerian parents over their children. It's more of criticism. And this is actually damaging the self-worth of this child. By the time they become adolescents, they'll be open to risky behavior, substance abuse, peer pressure, because they don't actually believe in themselves. They've been called names from childhood. They've been beaten. They are used to being shouted upon, and that has made them fearful that at the slightest thing, they're always hypervigilant. As a parent, you must set the pace. So charity begins at home. Every child follows what their parent does, not what the parent says. You cannot be yelling and want to raise a child that is calm and responsible and emotionally regulated.
If money is all you need, how come some of the rich that are depressed still kills themselves? So now my question is, how do you tell a rich man or a very rich person that you need therapy?
Not a lot of spouses are helpful to pitching, right? And dealing with that, I think that also is a traumatic experience. The economy is not what it is, so we need a two source of income in the family to make ends meet.
So you have a wife who is actually even traumatizing you, then how would you want to be vulnerable to that wife?
It's the Out Loud podcast show.
Welcome, ladies and gentlemen, to today's episode of the Out Loud podcast. And the Out Loud podcast is a show put together by us to bring you topics which sometimes you know, sometimes you don't know. Not be just about celebrity gist and gossips. Sometimes we bring you topics that are educative and innovative, so that you go probably learn from us as we did learn from you in the comment section, where you tell us things you like and things you don't like, how supposed and how not supposed to. Introducing my co-host, by my right now, Tracy.
Hello everyone.
And by my far left, Mrs. Chika.
Hello people, nice to be here.
Today's topic requires us to give you someone that is going to break this thing down, like bite them, chew them, masticate them, swallow them, digest them. Anyway, let me not go far. Let me introduce to you Dr. Olive.
Thank you very much, sir. Hello, everyone.
Dr. Olive, tell us what you do first before I introduce the topic properly.
Okay. Hello, everyone. I'm Olive, Dr. Olive Oluwagbemileke. I'm a clinical psychologist. I head Domestic and Sexual Violence Agency, the psychology department, and I also have my private practice also by the side.
Today's topic is therapy. You know, for Nigeria, we say I'm like say, they needed. But for from other part of the country, when things happen and people they feel like they get confused, you hear them say, "Have you seen a therapist?" Or that of Nigeria. A friend of mine will tell me say, "You see therapist," because not only me there. You see, other people say, "No, beside the mad." So which means in our country we see therapy like something unnecessary. Anyway, my name now B5.
Okay. Before we go into the discussion, I have a few questions. What is therapy and who needs therapy?
Okay, so when we talk about therapy, now we're talking in terms of psychological therapy now, because there are different forms of therapy. There could be massage therapy, music therapy. Now we're talking about psychological therapy, which is known as psychotherapy. And a lot of people have some misconceptions about counseling and therapy. They intertwine it. Oh, go for counseling, go for therapy. When we talk about psychotherapy, we talk about childhood issues that stem from childhood disorders, childhood traumas, unresolved psychological problems. So someone could come to me today and say, "Oh, I have marital issues." And by the time we do our psychological assessment, we find out that they have deep-seated childhood problems, developmental gaps in their childhood that's actually affecting their marital lives. So for instance, if somebody was abused during childhood, probably sexually or maybe by the parents, domestic violence in one form or the other, and has not actually processed those traumatic experiences and gets into marriage, and along the line you put copy, the person is angry, You put khaki in a place that is actually not supposed to be. Little things makes the person irritable. You find out that the person actually think that this my husband is very irritable or has anger issues. Meanwhile, you don't know that this person has unresolved childhood trauma. Little things get the person irritated.
Sorry to cut it. Would that not be termed as normal behavior? Maybe I like my things in a certain way and I get angry if it's not done the way I like them.
Good. There's a difference. So you have to, and that's why there's what we call clinical diagnosis for each and every form of mental health disorder. So when we're dealing with, for instance, trauma issues and all that, you find out that it's consistent. And diagnosis usually, if we're looking at PTSD, we call it post-traumatic stress disorder. That's usually for about a month. If we're looking at depression, that's 6 months. So there are some repetitive form of behaviors that is not just a normal behavior. You yourself, you look deeply and do some observations and know that it seems there's a problem. You might not even know. The person might actually even have some insight to say, why am I always behaving like this? I need somebody to talk to. And then it begins to impact on the person's everyday life or everyday functioning. And at that point in time, the person says, I need help. Now, why people run away from these therapy issues is that stigma. There's a lot of stigma in society about mental health issues. Abroad, it has come to stay. You understand? Therapy has come to stay. But here in this part of Nigeria, if they hear, you're seeing therapy, you think you are mentally challenged or you are mad, or it's like you're a psychiatric patient. You understand? But me and you are not far from issues that can actually break us down. And so therapy is for deep-seated psychological issues. So counseling is just for day-to-day challenge. I have issues, I need somebody to talk me through making some decisions. But therapy, deep-seated psychological issues over a long period of time.
From all you've said, you've talked a lot about what therapy is all about. So I can understand that there's a lot of misconception. We don't even know what it is. So I'm now wondering, because you've mentioned people that need therapy. From what you've said, it's like all of us in Nigeria, we need therapy. That's the truth now, because we've all been traumatized at one particular point or the other. So how do you now convince Nigerians that they need therapy? In fact, even having conversations in the bus and somebody is screaming at you, even while you're driving, people are misbehaving. We all need that therapy. So how do we come to terms, to know that we actually need therapy? How do you create that awareness to Nigerians?
So it starts from everybody. It starts from me. It starts from you. Enlightenment. I think there's a lot of enlightenment going on, but it's not really that, because therapy is kind of new in Nigeria per se. Not really new, but not as popular as the abroad lifestyle. Everybody knows that when you need some form of help, you see a therapist. Your issue is confidential and blah blah blah. But here in Nigeria, there's this trust issue. So people rather go to their pastors, go to their imams, or seek one spiritual leader or the other, or their parents or elderly people who will be biased, and they're beginning to see that such trust is fading, because your parents will take side with whoever is financially beneficial to him or her. The pastor will use you as a case scenario on the map. So people are now beginning to believe that therapy works. Now the next thing is the quality of the service they're actually looking for, because we have a lot of people on social media, I'm a therapist,
and if it's
I'm a counselor. Yes, everybody packages. Even recently I had somebody who was a social worker, wanted to come and study in my department, and I was keen against it, that this is why we breed a lot of quacks. You did your first degree, second degree, PhD in social work, and now you want to understudy for 1 month and say you're a professional therapist. That is why there's going to be problem.
Okay, but hold on. Do we have enough therapists,
unfortunately,
clinical psychologists in Nigeria? Do we have them?
Unfortunately, no.
They're not. We don't even know where they are.
A lot are leaving.
Good.
A lot of psychologists, psychiatrists, they are getting extinct.
So
most of my colleagues are this jackpot syndrome. Everybody's going because people are not really utilizing these services. People go to school to learn these things. I was sitting with somebody, a client. I was trying to resolve their marital issue, and the man said, well, you look 25. Why should I sit down here when I've actually met people of 80, 100? And I said, excuse me. I may look 25, but I started school actually, my university is by 25 years of age, and I have over 15 years of work experience. So you don't judge by the face, you judge by the quality of service. Now you say you don't want your marriage again, and by no means are you going to listen to me. Of what standard should you listen to me? I said, after this session, we'll get a feedback. And lo and behold, after the whole session, he was willing to give his marriage another 1 month. So it's all about you exposing yourself to professionals and knowing that we are bound by code of practice, ethics, that we don't, whatever you tell me, my license is at stake. I must not leak it out to another party. Yes. Yeah. So a lot of enlightenment, that's what we're trying to do. A lot of enlightenment.
So you mentioned something about qualification. Say I was in the market for a therapist, right? A clinical therapist. What should I be looking for?
Okay, so if we have clinical psychologists, we have those that are just psychotherapists, and we have counselors,
So what are the
certified,
difference?
people who are licensed, people who are certified, people who are qualified, and usually at the master's level to start with.
Oh, so there's a
Master.
Nigerian body for that.
Yes,
Okay.
yes. We have Nigerian Psychological Association. We have Nigerian Association of Clinical Psychologists. We have Institute of Counseling. We have standards, but so what you look at is the qualifications. So you start with the
All right.
qualification.
Let's say someone that has been traumatized from childhood.
Yes.
There's no way you could carry this trauma and live a perfect life without seeking the help of a therapist.
Yes. Well, yes and no, but yes to majority of cases, because it depends. Sometimes people have multiple traumas. Sometimes they come from homes that they've been abused. Like I was telling, I actually breathe in taking and living. I was telling people over the 10 years dealing with marital issues, domestic violence cases, child abuse cases. And I was telling someone in my office, we're training some new intakes. I said, it's not far from me and you. Is there anybody in this hall that was not in one way or the other abused? I had a client who said, oh, my child is having psychiatric issues, high anxiety, blah, blah, blah. And over the phone, I heard the way she was yelling at this child. That is just trauma.
Me. Hold on.
Yes,
let me say something. Because it's like we are mistaking what abuse from when we're young. What abuse seemed to be like when we were young. It's different what it is now.
Yeah.
Now, I can remember my father doing some things, and when I grew up, I realized that if that man did not take me through that part, I probably would not have turned up the way I am today. And today's world, they will consider that as an abuse, right? So, tell me where we draw the line.
Yeah.
Where we draw the line that this is abuse and this is training.
In disciplining your children.
Yeah.
Yes, so that's another dimension we are going to, but it's all good. So when we talk about parenting children, there's a difference between discipline and punishment. Usually, parents are not intentional in disciplining their children. They are only reacting based on the frustration they get as a result of the child's behavior. Usually, if a child misbehaves, they are angry. And they either hit the child, slap the child, and feel that if I don't do this, I'm not correcting the child, I'm not helping this child. But guess what? They're not intentional about what is the best way. Is this actually working? The Nigerian standard of training a child is to shout at the child, call the child abusive names, all in the name that you're actually raising a child. I don't know, they're actually traumatizing this child. You're actually inflicting emotional scars. Hardly do you get encouragement from Nigerian parents over their children. It's more of criticism. And this is actually damaging the self-worth of this child. By the time they become adolescents, they'll be open to risky behavior, substance abuse, peer pressure, because they don't actually believe in themselves. They've been called names from childhood. They've been beaten. They are used to being shouted upon, and that has made them fearful that at the slightest thing, they're always hypervigilant. You don't know that you're actually traumatizing your child that way. But a child could actually be talked to in a calm manner. You don't have to raise your voice. You could correct a child in a calm manner.
What if it does not work?
But there are different disciplinary measures, not punishment measures. There's what we call using their strengths as a measure. For instance, a child is doing something that is wrong, and what they like rather, and you're saying, I won't have you watch TV, I won't have you play games because of how you have behaved. There's nothing wrong with your personality, but this behavior is not good. If you grow up with this, it's going to affect you later on. And you explain everything to them. So you're not having TV or you're not having chocolates today because of how you have behaved.
So if I hear you, we should not be reactive.
Not that you should not be reactive, but you should be intentional. You should be able to, as a parent, you must set the pace. So charity begins at home. every child follows what their parent does, not what the parent says. You cannot be yelling and want to raise a child that is calm and responsible and emotionally regulated. If you are yelling, your child automatically learn on default how to also yell back. Your child also learn how to be aggressive. If you are temperamental, your child will become, oh, calm down. You cannot learn it, because where is he learning it from? When you are actually not calm, all he gets from you is also shouting too. So for now, a child who has been brought up with that and become traumatized, all he's used to is shouting, fear, being hypervigilant. How can he help himself except he sees a therapist?
So therapy can be self-taught, or
You can help yourself if you are really determined. But that will be much work on you. So why take the much effort when you can easily get it done by somebody who will put you through?
Okay, from most of the things you've said, it's like the problems we have today, most of them come from childhood.
Yes.
And majorly trauma. So I want to react to what he said, Mr. Bright. Like the things that our parents did to us, and we all felt that we are good, we are okay. Keep bragging, oh, we are okay, we turned out right. I think we didn't really turn out right, and we're passing it on to our children. So yeah, we didn't really. They flogged us. They flogged the shit out of us. I'm flogging a lot of things inside of us. I'm coming.
Who needs therapy? How do I know I need therapy?
Okay.
Because I can say I'm okay, like she said.
Let me finish. Because episodes are just coming out. I'm just seeing things, unveiling here. So now, because they did that because they believe they want to correct us, the rod and the staff. Now, in the course of correcting us, we were deformed. Good. So where do we now draw? Because he said something about speaking to the child's ego. Where do you now draw the line? Because at the end of the day, these children become entitled, too much validation from the parents. How do you draw that line so that you don't have a weak child? You need to have a balanced child that is not traumatized.
So we're not actually saying you should spoil your child. We're not actually saying you should, everything the child does, you pass the child at the back. No. But we're saying there are more sophisticated ways than the aggressive approach that you can use. The child is a human being, for goodness sake. You can calm the child and talk to the child. If you are calm, your child will listen to you. A child that is yelling, scream, now you also are yelling back. What are you going to talk to the child that is going to listen? No, it's with the emotions you are trained that he will be trained back to, and you get more frustrated. In fact, they even say in toddlers, they are even more resistive. The more you are aggressive, the more too they are actually also defiant. So, but you will now also model how you see the child calmly down. Say, I won't listen to you until you are calm. I can't understand the language you're speaking. You have to be calm so that we can discuss. I know you are upset and I know you are hurt by this, but this can't work.
I think it's because of this. That's why I say you want us not to be reactive. Because me, in the heat of my anger, I need to take a step back and be calm. That's non-reactive to actually speak to that child. Because if I'm angry, I'm like, why are you yelling? Stop it. But that's not what you're saying.
This is you saying you are angry. When we're growing up, if your mom is angry, she doesn't have to say it. She just look at you. When you look back, you know what she's saying.
That look has pushed fear to the child.
When your mom looks at you, you look back. You know what she's saying. Okay, you mean that's fear.
That's fear.
That shouldn't.
And one of the major symptoms of trauma causes all mental health symptoms, but the major one is anxiety, fear. Somebody who is traumatized is always living in fear and anxiety. The person's body system not as calm as you and I. Every small thing, the person hypervigilant is sensitive to little things.
But living in Nigeria, you are sensitive to there's anxiety.
Yes,
right?
Anxiety is needed for our day-to-day activity, but when it begins to interfere in your everyday life, every little thing you are afraid, every little thing you are anxious. Even when there's no problem, you're thinking there will be problem, then there's something wrong.
Okay, so we all need therapy.
And if you don't treat it like that,
we all need therapy.
Yes, if you don't treat it like that, it leads to depression. From depression, more other complicated mental health issues.
So why is it a very important? What you're saying is very, very deep. I'm thinking of all the children in the northern part of Nigeria that have seen and witnessed death. Children that kill people, their parents in front of them. They are all traumatized, and it's getting worse. So at this point, we all know, we agree. How come that a matter as sensitive as that is trivialized in Nigeria? Yes. Is it just I think it should be taken as important as when you enter a hospital, you see a clinical psychologist to talk to. All of us are not suffering from malaria.
It's now being done. It's done for those who are enlightened, you understand. But traditionally, like I said, cultural beliefs, the cultural norms cultural practices has actually influenced a lot of people. Like you are referring now, your home, your mother, that's still part of the traditional mindset. You understand?
Yeah.
Now we're living in the 21st century where people are being exposed to better practices. You know, they are questioning their background. They are questioning, oh, my parents are not actually perfect. But we grew up with this mindset that our parents are perfect. And it's a lie. You understand? But when they now see that this their behavior is constituting nuisance, you know, to their peers later on in life, they begin to reevaluate their foundation. I can now see that my parents are actually not perfect, you know, and that's where the shift in mindset comes into play. But now a lot of people are still operating on that traditional mindset that, oh, if they have issues, they talk to their mother. The mother too will look for however it benefits her, you know.
And based on her
yes,
knowledge.
and based on her knowledge. Sometimes might be helpful, sometimes might not actually be helpful, you know. Or sometimes they seek pastors or they seek their imams, you know, or other people who they feel are, you know, important to them.
Now, talking about people having problems and going to their pastors or the imam or the traditional ruler to kind of lay down their problem and see if they can get a solution from them. When your papa gets issues with you, like that, you will go meet village chief. They will come knock out those gong. So, talking to the imam, the pastor, please throw a little light on it. Let's know if it's probably what you do or what we should not do.
Thank you very much. So there's nothing wrong with you meeting your pastor or meeting your imam. But here we're talking of therapy which has treatment models. We're talking about trained professionals who have gone to school to study human behavior and study interventions that can be used to address deep-seated psychological issues. They may not have that training. And that's why I say you must see someone that is licensed. You understand? They can only give you what they know, which is limited.
But looking at the fact that we are Africans and we're very spiritual people, we've also seen times on the road, even on social media, you see a mad person. Somebody comes to him, prays for him, and he's okay. So do we excuse that healing ability? Do we remove it from? I mean, it has a way of pushing the next person to a pastor or an imam, because we've seen solutions spiritually from religion.
So now we're now going to two different things. And like I said, psychotherapy does not have to do with only mad cases, you understand? Any psychological issue, which are day-to-day challenges, you understand? Deep-seated or counseling, issues that you need counseling for. So if a pastor in his own way is able to heal somebody, that's good. You understand? And if the person afterwards, now the person is healed, but what is the coping skill going forward? Because when somebody is traumatized, for instance, somebody is raped in a particular street and the person says, oh, I have nothing to do with men again in my life, or I have nothing to do with that street again. The person has processed that event in a negative way. And if the person with time begins to react to that lifestyle, it becomes a mental health issue. So you see someone sitting by his side, the man talks to you, remove the face. You be like, what's wrong with this person? Not knowing that the person is actually going through some emotional tumors. You know? So that is totally different. The pastor is doing what he knows how to do best, but what is the coping skill afterwards?
Okay. All right. So let's come to the fact that you can self-heal. You can self-heal yourself. But how do we know you're not just self-healing and you're beginning to meddle with escapism, in the sense that you are beginning to numb a part of you that it doesn't really exist? You're living in denial and you're beginning to cope with things happening around you. You found a coping mechanism, but it doesn't really mean that you have healed. Maybe you have numbed that part of you.
Yes, so a lot of people like in Nigeria actually feel that they don't need therapy, they can do it by themselves. You know, like I said earlier, and I deal with a lot of domestic violence cases, and we deal with a lot of survivors, you know, who have actually experienced their husband beating them, shouting and things like that. And they'll tell you, I'm fine. It was just money to move on my life. I'm fine. Everything is good. But guess what? They are crying. And that is a sign that they haven't healed. Guess what? When you go into deep issues, they burst into tears. That is a sign that they actually haven't healed. And I say, do you know what? You actually need to heal. You haven't gone past your... So, no, I'm no longer with him again. I'm fine. I just need money to put things in order. I'm fine. Or they might even have money. But, you know, so how do you know? And that's why I said it's not so easy when you are in those situations to actually heal completely all by yourself. It's faster with the therapy. It's longer. It's like going on a long journey, you know, by road, when you can take a flight to where you're going to. So, and, you know, that will take you falling down, getting up again, stumbling, going through so much stress, looking for information here and there, working on yourself today, tomorrow you relapse, but at least when you see a therapist, from after your treatment plan, you can by yourself, it will be faster for you. It doesn't mean that the whole symptom will end immediately after the treatment, no. But at least you'll be 50% better.
I think there's a saying that the first thing in solving a problem is acknowledging that you have a problem.
Yeah.
So I think that's where a therapist. But on the light hand, I was going to ask, right? I've been meaning to see a therapist. How do you deal with people's problems? Imagine me. I'm not sure I can handle 5 people telling me their problems. Then how much more that you have to do it on a professional level, and you can't tell details of what people tell you to other people. How do you deal with that?
Well, I just feel your profession is your life. You understand? And back then when we were in school, our lecturers would say you are your client. So for instance, you can't get angry with your client even if your client is insulting you. So when we used to be in psychiatric hospital, which was part of our practice those days, your clients will even be insulting you. Some of the people who have actually gone to the other side, when I mean the other side, are really in deep mental health issues. They can abuse you today, tomorrow they are your friends, so we have to work on ourselves first. Even just like parenting too, you can't give what you don't have. That's one, first of all. 2, we also have time for self-care too, in the sense that you must balance it. Because I know when I even started working, particularly the field I'm specializing in, which is marital domestic violence, even then I wasn't even married. When I hear a lot of kids, hey, this is how marriage is, no. Or I'll start using eyes to look at the man. Or for instance, you hear a case of child abuse, the help, did this, and your mind is at your child immediately. So all these things we learn on the, we learn. We stay on the job and we use it to help ourselves. You have to be intentional about self-care. So self-care, you know when to strike the balance. You know when work is work, and take a break, recharge, and get back again.
From all this you said, it's clear to me that lots of us need therapy.
Yes.
No,
We all do. We've agreed.
I was talking to my friend, and he was like, "This, he said, you need therapy." I go see that.
Yeah, so I was going to say that there's a stigma with saying, "Oh, I'm seeing a therapist" in Nigeria. In other parts of the world, is a thing. "Oh, I'm seeing a therapist." Some offices will even pay for that. But now, luckily, I know some health insurance are giving that option to seeing a therapist. So how do we destigmatize that? Yeah.
There's a lot of enlightenment campaign. A lot of medical experts do that. Like every year there's World Mental Health Day. You see a lot of people. So it's still, we need more enlightenment, and this kind of podcast will also help to, to also share that there's no big deal. These issues can affect anybody, you and I. There's no special person. You don't need to be mad before you are having, everybody has problems in their life. Everybody has challenges. Even a therapist who has challenges. So at the point that I need to see another therapist to help. No, that's true. It doesn't mean I'm mad.
Exactly.
No.
When I told somebody, you don't think you need therapist. He said, how do you expect me to go talk to somebody that has his or her own problem?
Yeah, so because
The person's
there's
already
no
trained.
instant solution. I'm talking about it. So what does that help? Is the notion that we have. I'm telling you about my problem. So how would he help me?
No, so what I actually have to say at that point in time is that why do you see a therapist? First of all, it comes with the passion. Like I would say that before I even realized that I was passionate about what I do, everything comes with passion, not money. Because if money is involved, you can't do this type of profession. From when I was young, I'm always passionate about problem solving. I'm always passionate about listening to people's problem. And
So you're very empathetic.
yes, if you have a problem, I can, even if you wake me up from sleep, it is part of my best. I can dissect. I always want to see people happy. I always want to see people in a better frame of mind. So it is a thing of passion. If you don't have the passion for it, you can't do it. It's not just money. And that's why you know a quack from a professional, from someone who is passionate. Because if you are passionate, you won't mind the hours that are going. You just want to see that the person, you leave a positive impact. The person leaves you in a better space. But if you are after money, you won't even care. This problem is too much, or I'm sorry, I can't help you. Or you yourself, you know that you've left empty-handed. So everything comes with passion.
So from what you said, I think the bulk of the solution lies in creating awareness. And then awareness is one thing we're doing at the podcast. hospitals and doctors are doing this, but we know that some Nigerians are already excluded. So growing up, I think I was in primary 2. The first time I ever heard of HIV and AIDS, people came to my school and they bombarded us with that. You know, it was back to back to back to back. It was intentional. So I also believe that there's a lack of intentionality from the people at the tops. Like, yes, I want to believe so. I have my reasons for saying so. But I'm also asking, do you think that when we integrate the knowledge of mental health issues and therapy into our courses, I think it will solve the problems from the cradle to let us know that we all are in need of therapy as subjects in school, learning it.
I think that would take a whole a while. Well, what you're saying is, I totally agree, but it's going to
Because
take
there's
time.
some useless courses we are studying, like music.
It's gonna-
They're not important. Like, oh, I'm coming. You finish studying music, can't play. These are important life-saving courses, disciplines that we should know from childhood. Already you know that you're having a problem and I'm growing with a problem. So it's easier for you to deal with. So when we integrate it into our curriculum, it will solve a lot of problems and save money itself, of enlightenment and all of that.
You're right, but the challenge has to do with the society itself, and will I say people willing to take this though, because you find a lot of mental health experts are actually leaving the country because people are not valuing these services. True. And people don't even know the value, and people are not they're not even interested. Everybody is troubled with their own problems, trying to make money, trying to survive. You know, I was at a parenting workshop and we're talking about child abuse, child neglect, and different forms of abuse in children. And the parent said, how will I have time for my children when from morning till night I have to go out to work?
We're in a vicious circle.
The mother is at work, the father is at work, and you are telling me this is having psychological impact on this child. So, but how do I create that time, and how can I answer that question?
Okay, in all fairness, I work in a 9 to 5, and you have mothers dealing with the guilt that comes with leaving your child, and also the economy is not what it is, so we need a two source of income in the family to make ends meet. I'm not sure as an adult if I probably hear my mom say, oh, we probably would have been very wealthy, but I had to stop work to take care of you. How I would take that. Do you understand? Then you also have to balance. You have to make money for this child. You have to take care of this child. And also you deal with the guilt that, oh, you've now outsourced some primary functions. Yeah, and not a lot of spouses are helpful to pitching, right? And dealing with that, I think that also is a traumatic experience too. So we all have to, me, the child, the father, we all have to come and see at this point. And just so I think there was a question I wanted to ask. I can't.
Okay. How do you tell a rich man?
Yes. So because we're very classist in this country, there's the rich and poor. The poor man say, now who don't chop, they go see therapy. And in all fairness, you people are not cheap. I've done my findings because at some point I tried to see a therapist, but it's very expensive. And a rich man be like, you know the saying that you don't need to see a therapist, you just need money. So where do you guys come into all of this?
You don't, but we have rich. Yes.
Let me. But if that's the case, like you said, you don't need therapy, all in this money. But if money is all we need, allegedly this guy that owns Bookout, or the guy, one of the owners of Bookout, killed himself. Allegedly, like he committed suicide. If money is all you need, how come some of the rich that are depressed still kills themselves? So now my question is, how do you tell a rich man or a very rich person that you need therapy?
Thank you so much. You see, this is actually a very important aspect, because it's going to lead us into men's mental health. A lot of men are in denial that they need to see a therapist, even when they come for some form of marital intervention. To say, oh, I'm okay, I'm fine, just talk to her. You know, they have this ego consciousness that is the wife that is the cause of the problem.
I think
you understand? And they feel they are okay. I would trace this to societal and traditional cultural norms, cultural beliefs, whereby the men's ego is it's promoted to a heightened level that it becomes over bloated. You know, the man is made to believe that he must suppress his emotions, he must be stoic, you know, he shouldn't be emotionally vulnerable. That means strength.
Men don't cry.
Men don't cry.
mean,
and that is what is actually causing a lot of internal depression.
I think you're going to come back for this topic.
I really think because
Man's emotional. How we manage our emotions?
They don't talk to anybody. They suck it all up.
And that is what's leading to a lot of men these days attempting suicide.
Yes.
You look at a lot of statistics. 1 in 8 men come down with mental health issues in one form or the other. Yes, a lot. And that's why you hear this rich man today attempted suicide. Chairman of also attempted suicide. So if money is everything, then begin to look at it's a lie. It's not all about having money, because the cultural societal expectations believe that men should be able to bottle everything up, and that is wrong. That is where the problem lies. We need to change this mindset. There needs to be a shift that men, it's okay for you to be vulnerable in safe spaces.
And it is
not in a space that you'll be attacked or antagonized, but in a space that will be non-judgmental. You should express how you feel instead of emotional suppression, because emotional suppression leads to mental health issues. When you suppress your emotions, you become depressed. You live in anxiety. You live in a whole lot of psychological mess. And the man will become unstable. He won't even know that he's actually unstable, and he will be irritable. And he doesn't know that he's exhibiting symptoms of mental health issues.
So why then do we get married? Where are you supposed to be more vulnerable? Is it not in the place of marriage? So does it mean that men are just getting married for getting married sake to have children?
Yeah.
What about the wife that is meant to be your helper? Who best should you speak with or to?
If you hear from these men, like in my organization, we do what we call support and healing group certified. I introduced it because I found out that we're only facing survivors. Now, these men that are like perpetrators beating their wives, let's engage them. Let's know how they feel. Let's understand how they feel. And we found out that these men actually, they will say that their wives are not giving them the safe space they need. So you have a wife who is actually even traumatizing you, then how would you want to be vulnerable to that wife?
This, I tell you, my friends, is a topic for another day.
We need like 3
We
more
are
episodes.
going to do anything it takes for doctor to come back.
Yes,
we
she
need
needs to
break
come back.
this down. Like, we need to break this down. It is making so much sense, but unfortunately, we have to go. And before we go,
From all we've talked about, I think the mental health issues we have in Nigeria is coming from the home. We are all products of our nurture and our nature. So I want to talk to parents. What you do with your kids, it matters a lot. So you need to be careful. So we don't end up raising monsters that will end up raising more monsters that will trouble the society.
Just a brief one. I would like to tell anyone that is passing through any form of psychological distress, you need someone to talk to, you need a safe space that will be non-judgmental. Feel free to reach out to me. I'm here and I'm available.
no matter what life throws at you, it's safe to say that we all realize that we need that person that is not going to be judgmental to talk to. Feel free to reach out to Dr. Olive. I think she would give you 50% of the solution you needed.
Judging from all that we've heard, learned, unlearned, we all need therapy. I, for one, would make it a point of duty to get a therapist today. And I think we all should. So, like my co-host has said, so we don't raise monsters in the society, because the world expects the best of us.
I need to take this to Dr. Olive. Dr. Olive, first of all, tell us where we can find you, how we can find you, and what you really do.
Okay, like I said earlier on, I'm a clinical psychologist, and you can reach out to me on my number. Yeah, I could leave my number down.
You want to call it out?
Okay, 070-4948-9711. You know, basically, you could send an SMS if you can't reach out to me through the phone call, and I'll respond
Are you
to
on
you.
any social media platform?
Yes, but I guess my work, well, my work, I'm on social media. I'm not on social media. Yes, I'm on social media, but I'm trying to be active anyway. Are you on
Instagram, Facebook?
I'm on Instagram, Friedrich Consulting on Instagram, Friedrich Consulting on Facebook.
All right, thank you so much for giving your time for this episode. Unfortunately, this episode has come to an end, but we'll be back again. There's so much to unpack, and we would be looking forward to having Dr. Oli back with us. As always, please like, comment, share to your friends. We all need this. Follow us on our socials and recommend us to a friend. And as always, we'll see you next time. Have a lovely week. Bye.
It's the Out Loud Podcast Show.